doesn't necessarily happen at any one point. The effect on my soul and on my spirit can be difficult. I feel like I'm in a deep hole, and I laugh. I say, I'm trying to get out of the hole by digging with a shovel, and I'm just getting deeper. So I try and figure out a ladder.
Pain affects your mental outlook because you deal with it. It's like continuous, and all of a sudden, you begin to get depressed over it, and that's happened to me.
We really need to look at the person as a whole person, not just their diagnosis or their disability. Creative arts therapy does a really good job of taking a look at how we can address the whole person too through the arts. I'm a music therapist. I work for the Henry Jackson Foundation with Creative Forces, and I'm currently providing music therapy services at the Roudebush VA in Indiana. Can you play how you feel on the drum?
Right now?
Yeah.
Okay.
Creative Forces is a program funded through the NEA and placed creative arts therapists in military and VA healthcare institutions. Part of Creative Forces' mission is to do research and provide the necessary means to show how effective creative arts therapy is.
I'm a professor of medicine at Indiana University School of Medicine. I work primarily at the Roudebush VA Medical Center and Regan Street Institute. We work with Creative Forces Network. They are really serving as the funder of our research, but not only a funder, but really a collaborator. They provide input on our studies. They provide advice on how we could improve our research. Scimitar is a fully powered clinical trial looking at symptoms such as pain, severity, pain interference, psychological symptoms, depression, anxiety, stress, PTSD, and we're also looking at quality of life.
I am a core investigator at the VA Center for Health Information and Communication, and I'm also a music therapist. We use a biopsychosocial model when we talk about how music is impacting chronic pain. So from the physical level, we've seen from previous music studies that music can interact with things like cortisol level or the release of certain endorphins. So it is having an effect on physiological measures or symptoms.
Music therapists deliver the step care music therapy intervention. Step 1, which is a lower intensity music listening intervention. In step 2, it involves music imagery. One other aim of the study is to look at economic factors and whether they are cost effective. So we can potentially think about implementing these type of interventions more broadly.
I have chronic pain. I have effects from Agent Orange. I've had various cancers, and I have parts of my body that are changed as a result of that. I was lying to everybody. If I'm being absolutely honest, I lied about it. I told my doctors I was fine. I did not want to admit that I was facing the things that I was facing. The VA is treating me for PTSD and the related anxiety and depression issues that come along. I was doing it for probably close to a year. One of my therapists said, well, have you ever tried anything like creative arts? I said, well, what do you mean? And Tonya said, well, dance. I said, no, that's probably not going to do it. And then she said, well, what about drawing? And I said, I'm probably not going to do real well with that. She said, okay, well, how about music? And that struck a chord.
Sometimes with PTSD, it's really hard to verbalize what they've been through. But they can play it out, they can drum it out, they can strum it out. Playing instruments can be a part, sometimes it's not. The first part of the study, they do music listening. I meet with them the first week, and we create a playlist that they can listen to of songs they enjoy.
We started looking at tempo, and we started looking at tone. And she said, well, let's try and match that to your moods. And we started putting playlists together. So we're spending a lot of time now addressing how to be in the pain and then use music to help me mitigate it, lower it.
We're looking at music in a different way, not what's playing on the radio or in some recording, but playing in a way that helps them to feel their emotions or express their emotions.
We started saying, well, when I'm anxious, I always joke, I say, to me it sounds like a soprano trying to hit high C and just missing it, or fingernails on a chalkboard type thing. And I need to get that down to calm, which means I had to step down in the types of music, tempos and things I was doing. And then when you're depressed, you're down, and you can find music that I went used to calm me from the other direction. Start there and try and work my way up to something that pulls me out of the depression and brings me back up to a normal level. I could start opening up on what moods and emotions and what the music that we were selecting, how I related to those and how they affected me. I have found it extremely helpful. It's one of my go-to therapies on a day-to-day basis.
Music imagery is the second step, and it's really written in a way to be adaptive to the veteran's needs. So maybe they need a little bit more support on building their relationship with music. Maybe we can do emotion regulation. Maybe we can go to self-care.
I think I started out with the Marvin Gaye album, What's Going On, Three Tenors, Sam Cooke, John Coltrane, Stevie Wonder, Curtis Mayfield. First, we got into it with the breathing exercises and just kind of taking it easy, closing your eyes, meditating. You do kind of focus in on the music itself and how the music makes you feel. I did notice some relief or pain. Working with Tanya did change the way I listen to music. The Marvin Gaye What's Going On album, to me, is an anthem for Vietnam vets. When you listen to all the songs, they have a meaning. Hey, what's going on? You know, that was me coming back from Vietnam and getting back with my relatives and friends. And hey, what's going on? I've been gone for about a year. Tell me what's happening.
When I talk to veterans about their experiences with music in the study, the biggest thing that I hear repeatedly is that it changed the way that they think about music, and it provided them another tool for dealing with the symptoms. One veteran said, "It blew my mind. I had no idea it was going to work in that way."
It is a long process from conceptualization all the way to analyzing the data. And once it's collected, then we want to disseminate the results of what our findings are, how that can help to improve quality of care in a healthcare system or for an individual patient.
Research is so important for creative art therapies because I think ultimately we want to increase access to services for participants, for patients, for veterans in this case.
A lot of the veterans that I know also suffer from chronic pain. And I tell them about my experience with the music therapy. I think it benefited me from learning how to listen to music.
I thought I was in control of my life, and found out that these challenges that I have, they taught me that the word is cope. that I own these things. I can't change the past. I can't change history. I can't change events. I can't control things, but I can learn to cope with them. And that's what I'm doing.
We believe that creative arts therapies can help in chronic pain contexts. And I think there's some early findings that we are showing that.